everyone. I'm Barbara Hamley. Our original topic for Another View on Health had to be postponed. So today, audience, you are our guest. We offer you the opportunity to talk with our resident Another View doctor. He's cardiologist Dr. Keith Newby about what's on your mind. Are you concerned about your health care in light of proposed cuts to Medicaid and possibly other forms of health care coverage? Are you confused about COVID boosters, especially for your healthy children? What about other healthcare concerns you may have? We'll talk about it next on Another View, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamley. I hope you all had a wonderful Memorial Day weekend, the unofficial start to the summer. And before we get started with today's show, I do want to tell you, especially for our audience, because I know you guys are history buffs, the tribute to Tuskegee Airmen is coming to Smithfield on June the 10th and the 11th. Now, the Schoolhouse Museum is hosting this event. It's called Calf Rise Above Traveling Exhibit at the Luter Sports Complex on June the 10th and 11th. This is an opportunity for the young and the young at heart to learn the inspiring story of the Tuskegee Airmen and the Women Air Force Service pilots. By being immersed in a theatrical experience. So what's going to happen is that they're going to have they're going to honor Tuskegee Airman William R. White in the beginning on the 10th, and then they'll have music, and then you will see two movies that will talk about the Tuskegee Airmen, and you'll also be able to see a plane there. So this is all happening at the Luter Sports Complex, June the 10th and the 11th. The exhibit will go from 10 a.m. to 4 p.m. on each day. And so go on out to Smithfield and enjoy. So Dr. Keith Newby and I had a great topic for today's show, but our guest had to cancel at the last minute. And with the holiday this week, finding another guest proved challenging. So Dr. Keith Newby and I said, guess what? No worries. We got this. And we're just going to have a conversation about the latest in healthcare in our area, in our country. And we need you to participate. So give us a call at 757-440-2665 or 1-800-940-2240 and tell us what's on your mind. Hello, Dr. Keith Newby.
And how are you doing, Barbara?
I'm doing great. You and I can talk for hours.
Absolutely. So we don't need nobody else. We got this.
Exactly. Okay, so I want to start with give us an update on your schooling.
Okay.
What's happening?
So I am in the summer session. I have 3 classes I'm doing along with the 800,000 other things I'm doing. Fall, I take 2 classes and I'm done.
And you'll be done. So
December, I have my master's in public health. I'm going to tell you, we're going to do some celebrating because I'm going to tell you, it's been a long haul. Trying to be a full-time practitioner, running foundations, other businesses, and then going to school has been an interesting challenge. But I stepped my game up. And listen, I am so thankful to the good Lord for blessing me the opportunity to do this. I'm ready to get out of this. I'm tired of writing papers.
So what do you plan to do with this knowledge?
Well, I do a lot of community engagement work. You know how I am with that. And really I tell you one thing I will have to say, UNC is a very good school as it relates to public health. They rank like number 2 in the country. Mm-hmm. And, I've learned a lot about engaging, like how do you really take let's say if you're trying to do a program or you want to do an intervention, how do you do that? What are the steps necessary? What are the people you need to make sure you include in that? Mm-hmm. Even as simple as having meetings, how should you conduct a meeting? What are the things you want to make sure you include, exclude? I mean, they have done an excellent job, in my opinion, of
and
educating.
I'll bet that's even more important now because of the lack of trust that people have in public health.
Absolutely.
Since COVID.
So,
right?
I mean, for me, I love practice. I love practicing cardiology. I mean, that's really been always my first love. But I also love community engagement work and trying to figure out how do you start changing communities, because we have a lot of health challenges. And the stuff we're going to talk about today is making it worse if you really think about it. So we have to be able to be self-sufficient. We have to be able to be self-care. And because if we could prevent a lot of things that's initiating our healthcare challenges, we can hopefully help change some of the narrative of how we have to deal with it to make some of this stuff that's going on in the government not so much an issue that we have to deal with. So even how do we eat? Food challenges we have, instead of just doing a lot of people doing pantries. I've come up with an idea. I'm trying to develop those, my wife does those community gardens, towers, and I'm trying to develop a program where we have like multiple community gardens within communities. And then we have a separate, for those things you can't grow on those aeroponic towers, to have, I talked to one of my former physician assistants about, he's got a farm that's like 15, 20 acres in somewhere in the Smithfield area. And if we could try to look at how do we grow our own food to self-sustain communities so that we don't have to, depend on other avenues. So to me, self-sufficiency is the way we need to go, because if we can do that, then some of these health challenges we have with diabetes, hypertension can be negated. I mean, because really people really dismiss how significant what we eat, how we live impacts our health more so than you'll ever know.
And in light of the proposed changes to Medicaid, for example, and I pulled some numbers because I was just curious. In Virginia, the Medicaid expansion covered an additional 343,000 uninsured adults. 32% of them, so more than 110,000, were African American. So it's clear that a lot of people didn't have health insurance. We got the Medicaid expansion. Now they're talking about cutting it. What are you hearing from your patients, from your community work, in terms of what people are thinking about if that happens?
Well, I think the first thing is there's going to be a lot of fear. Now, what's going to happen is the medical community is going to have to deal with a lot of that, because it's going to impact where the number of hospitalizations are going to start to go up. The illness scenario, meaning those who are having the subsequent complications from these chronic illnesses
that they already have.
Strokes, heart attacks, heart failure, cancer rates, kidney failure rates, all these things are going to start to escalate. Having that coverage, I mean, for us is all about prevention. How do we make people's lives better? That's our ultimate goal. But these cuts are going to be impactful. Now, the issue has become right now it's more just a fear, because you haven't seen it.
Because we haven't seen it happen yet. Yeah.
But and I think we should be diligent in preparation, for that. We may not know what those cuts might be, but because we don't know, I think we need to be prepared for the worst. That way, because even if you talk, because it's not just Medicaid,
right?
It's Medicare,
Medicare too.
So if we have a Medicare shortfalls of coverage,
Lord
you think
have
about
mercy.
how, you think
This
about who
affected me directly.
I'm feeling you on that one. But think about the number of, if you even take illnesses in global sense, how many of each age generation are going to have these conditions is going to be the Medicaid population and the Medicare population. So, if you start making those cuts, and I understand the backdrop, people are saying because of what we spend, but I'm like, do we spend money in the right way? We really should be focusing on certain things as it relates to that. And we spend so much money on other stuff that I'm like, is that relevant?
So if you spend the money on giving people the ability to go get the preventive work and that kind of thing, that's less expensive than sending somebody to the hospital with a heart attack because they couldn't get healthcare insurance.
It just
doesn't
really
make sense. It doesn't balance.
Well,
right?
I think unfortunately so. I'm trying to say, how did I say this diplomatically? The premise in my mind of how we view healthcare in America, how do we rank the importance and what underlying issues come about as it relates to who's making money, who's not. Because it really, it's what it boils down to in the end. Who's benefiting, and you'll see things directed in that regard. I really would love for us to pull away from that concept. How do we take care of people? How do we enhance their lives in a way that's positive? So, what we eat is the first step, because again, you think about the ultra processed foods. One of my last classes, not throw this in there, but global nutrition. One of the things we did was looked at different countries. I can't remember if I told you this before, but just in our offline conversations. But one of the countries I looked at was Jamaica. And it was just, they say we had to pick a country, and it's years since I've been there, but I just picked that one because they wanted a low-income country. They used to grow a lot of foods there. They stopped doing that, probably 20, 25 years ago. So they import.
So they import everything.
Yeah. So, and the imported foods are typically ultra processed. So if you look at the obesity rates have skyrocketed there, the diabetes rates have increased, chronic illness rates have increased since that has occurred. So there is truth behind that piece of what we're doing to how we care for ourselves impacts our short and long-term health. And that's the thing that we have to get people down a different path of thinking. That's the hardest thing, because think about it. If you have, fried chicken, mashed potatoes and gravy, collard greens, fatback, whatever, you have all this stuff that we are so used to consuming. And then you look at how this impacts our short and long-term lives. Then you can start getting a sense of how this negatively impacts us, both short and long term. This issue of obesity lends to the incidence of diabetes, which lends to the incidence of hypertension, which lends to the incidence of heart disease, strokes, kidney failure.
So it's all connected.
It's all connected.
And it all starts with what we eat.
It starts there.
One way that we can eat healthy, though, is your community harvest farmers market that's coming up, right?
So let me talk to you a little brief about that. So we've been doing it. I think this is our third year doing this now. We did this really to try to serve the community, not just, we try to support local farmers. So when they bring their produce down to sell, because really they get kind of put out, there's a lot of connections where a lot of the big chain grocery stores would get them from their people they know and they like, and all
so
that.
Local farmers can't. They have a hard time
getting there. So we did this as a means to support that. But we wanted to do a little twist. We have our farmers market, we have vendors, all this stuff come out. But this time what we're trying to do a little different. So we're partnering, of course, First Baptist Butte Street, which is my home church. And part of the subdivision of First Baptist Butte Street is a group, ISA, which is their community development group. So we're all partnering together for the purpose of this. And what we're trying to do is get people living better lives. So not just teaching through vendor interaction, but we're doing some coupons where we're having people walk for free coupons to buy produce with. So they do a certain track around the church, and that would allow them to get the produce they need without necessarily, their only penance is they have to pay with time and walking ability. So there's there for them to support and buy, and and they keep the prices low. But in addition to that, if you walk a certain number of tracks, you'll get coupons to go and get the produce without
for free.
Yeah, for free.
So the Community Harvest Farmers Market, it is on May 31st. This is the first one this coming Saturday. Also June 21st, July 19th, and August 16th. Now, those are all Saturdays. It's from 10 a.m. to 12:30 p.m. at 418 East Butte Street in Norfolk. That is the Scope Arena parking lot, and right behind the church.
And you'll see the big tents out there.
Tents and everything.
And having people come out for that. And we also have a young lady that's going to be doing some cooking demonstrations on how you can take something good and keep it good, because you can take something good and make it bad really quick.
Real fast.
So we want to try to also, so we're really hoping that this stimulates both conversation and interaction and intervention that we could do that's going to help people live better lives. Because I'm going to tell you, it's just living this stuff every day and seeing the aftermath of people's poor health. I mean, it can become really disheartening. And I really went into this with an altruistic kind of thought to say I want to help people, and I do. I still, even in my older years, I still feel the same way I did when I first got into this business of medicine. Is I'm here to try to help people. But one of the things that this public health degree taught me is some of the underlying reasons why people get sick. Now, they don't teach that in medical school. Like, I'm really encouraging to incorporate more public health ideology into medical school education. But I tell you, that I really have come to some eye-opening revelations about how these social determinants of health, and I mentioned that before, impact your health. You think about
such as give us an example.
Environmental. My sister, who really well, she got a grant from the state to look at highway, kind of intervention, how highways depend on where they run by and how that impacts health in certain communities. But you think about where if a certain community lives in a certain district, and that district is surrounded by, say, industry, then that means you have pollutants and other things that impact the health of that community. So if you look at zip codes and you start seeing an incidence of cancer rates being higher in that particular district, then you have to start saying, well, why is that? I mean, that has to be something environmental that's driving that ship. So being able to really start looking at how, this redlining and other things is not just to create elections.
Not so much for redlining for housing and that kind and political, but also for the environment and your health.
Yeah, and that has a big impact. And you'd be surprised. I mean, you think about somebody who lives near a shipyard, or they live near a factory that's spewing out whatever, coal factories. You get respiratory problems in neighborhoods with that because that wind blows.
Because I know
that's
Lambert's Point has.
And I remember a few years ago, I remember seeing because I live in Larchmont, and I remember I came outside, saw this black stuff all over the yard, but something happened over there that got some into the wind, and all this coal dust came over, and it really just messed it. I mean, it took me like weeks to get all that stuff off the house and what have you.
Wow.
So, I mean, you think about somebody's breathing this stuff in
every day,
or you think about certain districts, say if it's a public housing area where they have high, incidence of, let's say, carbon monoxide or whatever, that's going to impact that community, So, depending on how things are constructed and certain things that say certain safety mechanisms were in place, that impacts. Think about when the asbestos stuff that came around years ago and why they had to stop using that. It's just so much that
lead paint.
Yeah,
I mean, all those
all
types
that,
of things.
So all that stuff impacts, and then it causes short and long-term health challenges.
757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Are you concerned about what you're going to do to stay healthy in light of the proposed cuts? Give us a call and let's talk about it. 757-440-2665 or 1-800-940-2240. So I personally came to the Keith Newby Clinic to get my COVID shots back in 2020 and 2021. RFK Jr., who is the health secretary for our country, yesterday ended the coronavirus shot recommendation for healthy children and pregnant women. I'm curious about your thoughts on that.
Well, this is the thing. I lived through COVID. I lived through seeing family members die of COVID, friends die of COVID, colleagues died of COVID. I was a firm believer in that shot because I'll tell you why. The shot came out kind of semi in November of, I think it was 2020 or 2021. I can't remember now because I try to not remember so much. I remember it was in November where it was released.
November 20. Yeah. Because COVID started in March of 2020.
Yeah. So I think it was fall of that. So I remember when the shot came out, it was like in the end of November, something like that, where it was becoming accessible. And I remember that I had mine in December of that year. And then I started looking at how the death rates, hospitalization rates, all that, it was like a precipitous drop by February, March of 2021. I mean, we're not talking like a little bit, like a 5%
few.
drop. I'm talking like 30, 40, 50% drop in deaths and hospitalizations in vaccinated individuals. And I'm gonna tell you that the negativity of vaccines. I mean, it's like it amazes me that we have been conditioned to think that vaccines are the enemy of the people. I got tons of shots when I was a kid.
Me too.
I mean, I still live to tell the tale.
Yeah.
I mean, I look at people who have fought me tooth and nail by getting the COVID vaccine will call me up and ask me for some doggone Ozempic. I'm looking at them like, are you kidding me? I said, so you wouldn't take the shot because you said you didn't know what's in it. What's in Ozempic? You know what's in that? But we have trained ourselves to think the vaccines are negative. Well, I still got COVID even though I got the vaccine. I said, yeah, well.
But you didn't have it as bad.
Well, that's the thing I'm trying to tell people. You got to understand, how do vaccines work? What do they do? You have not, and I think I've used this analogy before. You talk about when you are an individual, that's almost like you're an army of one. People who viruses mutate and they replicate quickly. So when you get an infection, the virus is replicating in your body. So your body has to fight off that replication. Mm-hmm. So it has to be able to recognize A, what it is, B, the antibodies that your body has to produce have to produce fast enough to fight that. Mm-hmm. So people don't really understand. If your body's never seen the virus before, it doesn't know how to deal with that, not quick enough to be able to work. So a lot of people will tell me, I exercise every day, I eat right, I don't need a vaccine. I'm like, yeah, but your body's still never seen it. You're better off having done the exercise and the eating right, but your body still hasn't seen that virus. Mm-hmm. So it may try to react faster, but it's not going to react fast enough to prevent that infection. I had some of the healthiest people died of COVID. Wow. So that's not going to do it. So to me, now granted, we are in a different phase of COVID. Now, I'm not going to lie on that one. I have seen markedly less deaths, but there's got so many people who have been vaccinated too. Mm-hmm. And the virus has mutated. But the thing is, I'm going to tell you, you ever had the flu?
Yes, I've had the flu.
You know how you feel when you get that? I mean, there's nothing fun about getting sick.
Right.
And when you get a virus infection, I mean, you can feel miserable. So to me, I'm like, okay, if this is going to help me not feel miserable if I get an infection, I'm going to do it because it ain't nothing fun about that. Mm-hmm. So I tell people, don't look at it as a negative thing. And all this anti-vax stuff that's out here now, I'm like, listen, I'm a Duke guy. I may be in UNC, but my Duke roots are still there. And at Duke, it was all about the data. What does the literature say? What are the recommendations based on facts, not fiction? And that's why I try to caution people.
And when you look at measles, as an example, I mean, we all had that MMR shot when we were little, and the measles went away, and now we've got this influx of people getting measles again. I mean,
and that's just right. And listen, some of this stuff, you think about the mumps and some of the long-term ramifications that you could get. A lot of people don't really think about that. They'll just think, well, I'll get over it. But some people don't. Even with COVID, there's still some long COVID syndrome folks out there.
And there people are really struggling.
Yeah. So, I mean, to me,
the other thing that I thought was very interesting, though, because particularly for African-American women who are disproportionately negatively affected by pregnancy. Yeah. I mean, the mortality rate is so high in the community. And so if we're telling healthy pregnant women not to get the shot, but isn't that one more thing that could add to that possibility?
Yeah, this came out this kind of, and I don't want to say nonsense but this aspect of autism, and everybody thinks that that's coming from vaccines. I'm like, prove it. When people say things to me and they say it with such authority, like they know it, prove it. Show me what you, and don't give me some nonsense you got off the internet. Show me some randomized, double-blind, clinical controlled studies demonstrating your point, and I'll stand down. But because I know they can't come up with it. It's just like you think about supplements. Supplements where you see this and they'll say, it cures the mange. It does all this stuff. And I'm like, okay, prove it. Because it's not out there. These are unregulated things. Now, for the majority of people, it's not hurting them. But will it do what they say it's going to do? You can't prove it. So it's not going to hurt you, but will it help you? So to me, when I look at weighing risk-benefit ratio, when they say healthy children, what does that mean? Define what's a healthy child.
What's a healthy child?
Yeah, or look at people with. Now they are saying. I think they're saying still if you have chronic illnesses.
They're saying that seniors and people with chronic illnesses or compromised immune systems.
Yeah. So now granted, those are the people that may be affected the worst.
Right.
But flu symptoms are still no fun. So if I mean, to me personally, I just don't want it where they stop paying for it. And people because listen, give me the shot. I'd rather take my chances there because I'm going to tell you, having seen people die of COVID, that was not a pleasant experience. And I had a patient die of COVID not that long ago. So we're still seeing deaths with COVID. It's not like that's gone away completely.
If you're just joining us, it's Another View on Health with cardiologist Dr. Keith Newby, who also serves as the Market Director of Community Health Improvement and Engagement with Bon Secours Mercy Health. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What's on your mind about healthcare in America today? Give us a shout, 757-440-2665 or 1-800-940-2240. So the other thing that RFK Jr. has said recently is that he may bar scientists, government scientists, from publishing in top medical journals like the New England Journal of Medicine, like Lancet, like JAMA. Don't you all read those periodicals to get new information?
These are peer-reviewed documents. See, this is kind of like I feel like I'm back in the World War II era where they're controlling information that you get access to. I mean, to me, now it's one thing if somebody's publishing propaganda. I'm not going to say too much on that, but this is still a freedom of speech issue. But if you're going to limit somebody's ability to, to have those discussions and to publish data, I mean, because I'm going to tell you, I'm been a published person before especially when I was at Duke, because I did a lot of publishing when I was there, presenting papers at meetings. The process that you have to go through, because I'm going to tell you, it's a rigorous process. You can't just
write something and
put it out there.
Yeah.
You know how many people review it and how many times you have to rewrite it? When they say they don't like this or show us how you came to this conclusion. I mean, these things are not just, let me just willy-nilly put something on a paper and put it out there, because they're not going to publish it.
So then if it gets published, that is trusted.
Oh, yeah,
and these journals have been around since the 1800s.
Absolutely.
So, but he says now they're going to create their own.
Yeah, yeah. Anyway, that right there is a red flag to me, because because I mean, and this is, I'm not going to sit there and just kind of dog people out, but you're not a medical person. You have no medical background understanding, no knowledge, no nothing. And that'd be like me doing a finance journal. What the heck I know about that? I know enough to be dangerous. So you're going to trust me to invest your money when I'm like, okay, what's your background? So, because think about it. When you go to school, it took me 17 years to do what I do. 17, including college, medical school, training. 17 years to be able to be a cardiologist. So, and then you're going to be where you're going to read an article 2 minutes and all of a sudden you're an expert. That's the issue. That's why I tell people to be very cautious with what you read. I'm going to do a quick shout out. One of my good friends that I work with, Dr. Tia Nelson, she's a primary care. We had these discussions about this kind of stuff, and and I worry about her because she's pregnant now. She's about to deliver in July.
Oh,
and
congratulations!
So I was telling her today. I mean, she always listens to this show, and we'll have a discussion every time I come back. But I say all this to say that she and I will have these philosophical discussions about this kind of stuff. But, the thing is, when people read something and then all of a sudden they're an expert, the problem is they don't have the background understanding to know how to navigate that
How
information.
to put it into context.
Yeah, exactly. And that's the issue. I caution people with. I encourage people to read. Don't misunderstand that. But it's understanding how to apply it. What things do you have to look out for when you read something and you say, something, I'm having a little doubt about that. But I can tell you the reasons why is based on the understanding of the literature.
So that takes me to this point, because that's a really good point. A lot of times now with the internet and all, you can get an ache, a pain, a burning hand.
We won't go there.
Whatever, and go online to a variety of places online to find out what's wrong with you. You're doing this self-diagnosis. Yeah. How dangerous is that? And I mean, in other words, how do you filter it out so that you use the information to maybe figure out, maybe I need to go to the doctor, but you don't want to start self-diagnosing and not really taking care of yourself.
I think the first key thing is understanding the severity of the situation that helps direct you to know what to do. And I give you a prime example. If I have a 15-year-old kid with no medical conditions that complains of chest pain, I'm looking at them a whole lot different from if I have a 70-year-old who has hypertension, diabetes, smokes like a chimney, and their father died of a heart attack when they were 40.
Got you.
I'm going to take those individuals, much
Separately,
different.
yeah.
That's the issue with AI, because a lot of people, I keep hearing this kind of thing about like AI doing this, you won't need doctors anymore. And that's nonsense, because AI is a man-made technology. So, when I'm talking like to you versus talking to another person, I'm looking at your body language, how you say certain things, what you emphasize. I'm able to discuss issues with you, and I can tell based on your responses what I need to ask other questions about to get to an issue about a health challenge versus somebody else, or I may do it entirely different because they're a different individual. You can't. How can you teach AI that? It's just impossible. They have a formula that they're going to work through, and they could give you a wrong diagnosis. And you see, if you even look up some of the AI technologies, when people reviewing them, they'll say sometimes this stuff is wrong.
Right, exactly. And they tell you, make sure you double check.
And some doctors are wrong too. Don't misunderstand. But at least we have the background to be able to, it's the nuances. Because, if you get a patient, and anybody here listed that are hypochondriacs, don't take this personal, but there are some people who, like, the least little thing happens, they run to the emergency room, and they'll go to the emergency room 50 times for the same thing. And they told them 50,000 times that they're okay. This is not a heart-related issue or something else, but they keep going back because of their fear factor. And people that they have read a lot, they'll sometimes alter, not necessarily purposefully, but they'll alter their story to fit the narrative that they want to have take place.
Get help.
So when you look at that, AI can't do that. So this is the stuff I'm talking about, that we have been trained in medicine for years to know how to navigate people to the best diagnosis, because you really do want to help people. And we're not perfect by any stretch, but I just think we have the advantage of having had the background and years of doing this. I mean, think about it. I mean, I spent, after medical school, 3 years of internal medicine.
I bet your hair wasn't gray back then.
No, it wasn't. No, it wasn't. It became gray quickly. But you think about I was a total of 7 years doing nothing but seeing patients and under somebody's watchful eye. When you're talking about being on call every third or fourth night, every third or fourth weekend, where you're constantly seeing people. And I trained in Atlanta and Durham. So Atlanta was at the time I was there, I was HIV capital of the world. I mean, I knew how to deal with any HIV diagnosis, but we didn't have the drugs back then that they do now. But, you saw the nuances of all the things. I mean, spinal taps, I could do them in my sleep because everybody came in HIV, fever, and a headache. So you didn't know they could have cryptococcal meningitis or toxoplasmosis. And so and I can't believe I remember this stuff from that long ago, but I said that to say that the exposure you have and being able to decipher when you see the same kind of thing, but it can manifest different ways, being able to figure all that out, that takes experience and time and dedication to learn how to do.
How to do that. Barbara from Kilmarnock called. She wants to know the best way for a public health official to counter disinformation.
That's a very good question, Barbara. I tell people this all the time. Trusted sources. You have to figure out what's a trusted source. I tell people all the time, and I've done shows about this before when I say you have to understand the background of that information. Because I'll be honest with you, some of those news shows today, they're clearly directed to certain places. Republicans listen to one thing, Democrats listen to something else, and their narrative is directed to prove points. So you have audience. When to me, the first thing I always say is talk to your doc. That's the first thing, because they can help guide you in terms of what are trusted sources. I use like some of the medical, I think Mayo Clinic, and Harvard, and I know Harvard feels under the gun right now, but but I look at those kind of places, Johns Hopkins, Duke, Emory, where I trained also. All of them have websites and information that they got no dog in this fight. In their mind, they're trying to help you. So you'll look at, and you'll see the same narrative typically, no matter where you go. Because they are going based on data.
Right. What
the literature says. So I tell people all the time, look at these organizations and academic institutions that have a great reputation. The U.S. News and World Report, every year they do that best hospital list and what have you. So, and it's a process in which they do to look at who are the best places. So I would say you look at those, if it's like, say, neurology, it is this place, or cardiology, this place, and look at their sites, because, again, they got no dog in this fight. They're not doing this for other reasons.
The other thing that she also could do, or is this another thing you can do? Because sometimes you have the information, but you still may not be able to communicate it to the community, and finding a trusted resource in the community also to help back you up, if you will.
I think what I have done personally, and I think because of my position, and most people that deal with me know I'm all about somebody else. I don't do things for me personally. I do things probably 99% for other people. So when I if I do a post on Facebook, or if I do a talk in the community, I'm doing it for a reason of trying to help somebody else. So I think, partnering with churches that are heavily into healthcare items, partnering with 501c3s that you find those organizations that can help you disseminate information, and you get a platform. And I don't dismiss social media. I think the problem is understanding how to use it appropriately and how to decipher the good and the bad. But if you tell me you get the vast majority of your medical information and news on TikTok, I'm just like, are you kidding me? So, because unfortunately, so I can get there, post anything I want. Yeah. I can say anything I want.
Yeah.
And unfortunately, so there's not a lot of regulation. So if I can do that, that doesn't make me right. So you have to find those individuals and groups that you think have a vested interest in disseminating correct information. And most people, I think, do. I think that most people have good intentions. There are a few that may not, but I think the vast majority of people do. So if you find
still have faith in people.
I always will. it's just, it's in my DNA. I can't help myself. I do, because I just think that's just the way we should be.
Absolutely. So if you could describe the ideal patient, what is the ideal patient? What should we think about as we're interacting with our physician?
I think one of the biggest things is honesty, being forthright in terms of your symptoms and your shortfalls. A lot of people who, like, I have somebody who, every now and then I get somebody that's really markedly overweight. They will always try to preface everything, my weight has nothing to do with this. I'm like, no, it does. And you are not capable of making that determination, firstly. So I think honesty, being forthright, but being understanding of your physician, doctors. I just mentioned to you before I came in here today. I got 50,000 calls of people that looking for me to call them back. And I try to tell people, I said, listen, it's hard to call everybody back, but if I do, let me tell you what I need to tell you. Let me get off the phone.
Yeah,
you try to hold,
that's not the time to have a whole long
I mean,
conversation.
if I have 50 people to call back and you try to hold me on the phone for 30 minutes after I've been working all day long, just try to understand that, we are working all day long. I mean, I'm up at 4 every morning without fail. I'm in that office before 5. Pre-round, go to the hospital, round of patients there, come to the office all day long, typically average of 30 people.
And somewhere in there you do surgery too, don't you?
Yeah. I mean, I sneak it in there wherever I can, and then you have, at the end of the day, it's not like it's done. Still got notes to finish up, phone calls to make, test results to provide. And I try to ask people to just be patient with the process. It's not that people are trying to put you off. And I understand it's tough when you're worried about your health. I do get that part. But the vast majority of us is something serious. We're gonna get to you. You're gonna be the first one we're gonna call.
You do prioritize.
Yeah. So because if something's
Yeah.
normal, then if it's normal, they'll say, "Well, what does that mean?" It means it's normal. But just understanding. To me, the ideal patient is one that's just concise. Give me what I need to know to help you. Be understanding and just be kind of inquisitive, though, because I want people to ask questions, because if they understand what's going on, it helps you help them. So to me, I never mind people asking questions. I just ask you to be concise with them.
So do you think a lot of people may hold back on things because they're afraid you're going to judge them?
Yeah, I'm sure they
what
do.
They do.
But that's where the trust part comes in. Most people I deal with know they could talk to me about anything. I mean, who am I to judge anybody? That's why I don't run for office. My skeletons are going to stay right where they are. So, I mean, there's no perfect people out here in this world. Right. So, and we're not either. So I think if you have a physician that you feel comfortable with, that you can trust, that to me is where you should not be holding back, because what you're holding back may be instrumental to our ability to diagnose your problem. So, it's just that's to me is really our ability to communicate information, but we have to have enough. And to me, if you hold anything back, it doesn't help us help you.
How's the mental health of our community these days?
It's a hot mess. But there's several reasons I think why. It's not just, I think some of it is again, it goes back to what we eat. I think it does impact, but I think just the environment in which we're into now, this is different than it was, 40 years ago. And this access to information, that's the problem. And it's not to blame anything, but I don't think social media has really helped us as much as it's hurt us. There are some advantages to it, but think about, what kids have to go through. Before, you didn't know people talk bad about you unless you saw it in the bathroom wall.
True.
But now
they absorb that every day.
Yeah, and they're looking at this stuff, and it really impacts their self-esteem. There's a lot of factors that I think are negative. So it really is going to impact. And then resources, how do you even, you have to recognize that you have an issue, and then you have to be able to find the resource to help you. And they're not as easy to find as you would think, because everybody's booked up. Everybody's busy.
Let's talk to Tom in Moyock. Hi, Tom. You're on the air.
Hi.
Hi.
I hear from some people that if you get vaccines, it decreases your immunity, which it sounds to me ridiculous, because they think that you're relying on the vaccine instead of your immunity. But in my opinion, the vaccine adds to your immunity. It adds about a specific thing, like the specific virus it's for. And I don't understand how people get this kind of understanding. And secondly, I want to hear if you think, when we're born, most of us who are normal have more lung capacity than we actually need. But as we go through life, that lung capacity decreases slightly. And every time you get an infection like the flu or cold or COVID or bronchitis or those things, a little scar tissue may be left over in the lungs. And we all diminish in how well our lungs work as we get aged. So we want to take vaccines to protect our ability to have enough lung capacity in our old age that we don't suffer before we die.
Tom, thanks so much for the call. We really appreciate that. You want to respond to Tom?
100% agree with you. I think if you look at the design of vaccines are designed to expose you to some non-infectious aspect of a viral molecule that's foreign, because the body has to recognize the foreign aspect of that, whatever that is, to be able to build antibodies. Because anything foreign in your body, the body likes to fight against it, but it has to be exposed to it and know what to do. It has to be able to recognize that. So actually, it enhances the immune system to that particular whatever is going, and it's trying to fight against. So it does actually enhance it. Now, again, this goes back to that propaganda and the negativity of people who have come to this conclusion through no facts. I mean, I'm a fact finder. I mean, I'm like all this making stuff up as you go along, and some people, they believe this stuff. I mean, it's like it's a deep seated kind of thing where they'll just like fight you tooth and nail. And I'm like, but you got no proof to what you're saying. Well, I read it. I'm like, I can show you 20 other things that say the exact opposite. Who's right and who's wrong? Look at how did they come to that conclusion?
What's the major trend?
How did they come to the conclusion of their determination? And I said, to me, once that happens, and I don't want to go on what somebody says is the case. I want to see the data that proves it. Because to me, once you've done that, then we're done. There's no more thing to talk about. Especially when you have multiple studies showing the same thing. I can understand, depending on the study design, there may be some nuances that may not pan out. But if you have multiple studies showing the same thing, that's not a conspiracy theory.
So we got about 7 minutes left, and I'm thinking about these weight loss injections.
Right.
And if they're already expensive, some insurances cover things, right? But if it were to come a time when insurance stops covering it and therefore people can't get it,
right,
what's the impact of all of a sudden you stop?
Well, it's no negative impact other than people probably gonna start gaining weight back, but the thing is, what these meds are supposed to be designed to do is not to replace your dedication to losing weight. It's supposed to be an aid to help you. So in other words,
you can't just take the shot and not walk.
Eat right, exactly. Because what happens is what those shots do, they decrease your appetite. That's really all they really do. So when your appetite has gone down, you don't want as much. But some people eat for different reasons. If they're stress eaters or whatever. The thing is, when you've had those injections, a lot of people, they just feel full, so they don't want anything. So then they lose weight by that fact. But if you just stop it, it's not that it's going to do you some harm, like a rebound effect. But it can make you gain weight, but not because it's just going to make you gain weight because you stopped it. It's just because you're going to start eating more again. So you have to recognize your limitations. And I don't think anybody should be on these drugs forever. They should be on a defined period of time, and it's designed to help jumpstart you so that you can begin the lifestyle change. But again, say if there's some mental issue that was driving it, meaning like say if it was depression or whatever, if you're not addressing the underlying problem, you're going to just go back to what you were doing.
So would you be, as a cardiologist, would you prescribe that for someone to keep their heart because of a heart issue because of their weight?
There is data out there that supports its use for, to prevent cardiac complications, but I don't think it should ever be dependent upon as a sole and only mechanism. A lot of people are using it. They want the easy way out, so they look at that as a substitute for the things they need to do anyway. I don't think it should ever be that. Anything what we do should be a program of thought. How do you, getting from point A to point B, you want a straightest shot to get there, but you want that straight shot to be a healthy and safe space for you. So if you do the whole program, then I think you have better opportunity to live a healthier life versus if you just do like, okay, I'm just doing this to substitute what I do. You may lose weight, but it may not be a permanent weight loss
Okay,
issue.
We got about 4 minutes. I'm going to try to get Nicole in from Norfolk. Hi, Nicole, you're on the air.
Hi, Barbara. Hi, Dr. Newby.
Hey.
I have a quick question on membership fees. So my doctor recently offered a membership to see her. And is this common? And does that mean people that can't afford the actual membership can't can no longer see the doctor?
No, it depends on. That's called that concierge type practice. And
Thanks, Nicole, for the call.
A lot of people, some docs have gone to that. I haven't really been interested in doing that, to be honest with you personally. But most people, I've seen where people would do like a mix. So they do some concierge services and some regular insurance carriers. Some people go all concierge, and what they're trying to do is instead of fighting with insurance companies, if you just pay the fee, you just pay a fee and you get your care, regardless of whatever. But the only issue is going to be if you're doing that, you still really need insurance, because if you get sick and go in the hospital, that membership fee is not going to touch a hospital bill. So you still need that regardless. But I think it depends on the type of scenario you want to have as a physician with your, as a patient with your physician. So there are some people who prefer that, and there are some people like myself. I don't really feel I want to do that. I'd rather just kind of do the standard way that we do it and move from there. So it really depends, Nicole, on your individuality, how you envision that, and the type of relationship you want to have. Because a lot of doctors try to do that, so they limit their patient panel and they just focus on those people. Yeah. So there are some advantages to that if they come through with what they're supposed to do.
Last 2 minutes, give us 5 things we can do to make sure that we start to stay healthy.
Okay. First thing I think is clear your mind. You've got to find a way to decrease your stress level. That's going to impact so much in terms of how you live, because that impacts other things you do. You want to make sure your activity stays up. I think the American Heart says you're supposed to do some type of moderate activity, at least 30 minutes, 5 days a week. So that means walking. It's like I walk to the hospital every day. I do that for that 30-minute scenario. I think you need to eat better. You need to understand and educate yourself on healthy eating. And I know people hear that health and they kind of, it's like, that's a bad word. But I know, but you can, but you get that, but you can alter, depending on the spices and things you use, you can make it taste really good. My wife's all into that now. I mean, she hooked me up last night with some stuff, and it was really very little sodium in it, but she just knows how to do that stuff now. I think, learn to find a doctor that you can trust, that you can communicate with, and do that. And then I think fifthly, just make sure you go to that doctor on a regular basis. Don't put off, and as a side note to that, try not to just use the internet as your source of medical information. You want to take the information you read and take it to a medical professional and make sure they can help walk you through the process.
Dr. Keith Newby, as always. I told you we could talk for an hour and just roll it right on through. Yeah. Want to remind you again, the Community Harvest Farmers Market, a celebration of community health and giving back, starts this Saturday, May 31st. It is at 418 East Butte Street in Norfolk from 10 a.m. to 12:30 p.m. And not only will you see farmers out there and so forth, but you also will have a chance to do some walking around and get coupons maybe for some free stuff.
There you go.
There you go.
And thank you for our community.
There we go. Thank you, audience, for spending an hour of your life with us here on Another View. Listen to this show again or share it with a friend. You can find our podcast at whro.org/anotherview. You can find us on Spotify or wherever you go for your podcast listening pleasure. Now, next week on Another View, why diversity, equity, inclusion, and justice are not bad words. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Victor Bowen served as audio engineer for Jordan Christie, who is tying the knot this weekend. Go, Jordan. We're wishing you the very best with your wedding. Congratulations, and thank you so much, Victor, for filling in. And Dr. Barry Graham answered our phones. I'm Barbara Hamley. Have a wonderful weekend, everyone, and let's get together again next Thursday at noon for Another View.